this co-pilot who apparently and allegedly drove that Germanwings jet right into a French Alps mountainside last Tuesday, had been suffering depression, apparently for quite some time, and bad enough that he actually had to take time off his training back in 2008, and bad enough that apparently he had gotten a doctor's excuse to not work, or had a doctor's note that he was excused from work on the day of the crash. How can depression like this go undetected, I suppose the question would be, by your employer, and what do you do about it if you are an employer? Dr. Frieda Birnbaum is, among other things, a research psychologist, joined us on the line this morning, and she's an expert on depression. Dr. Birnbaum, good morning, and thanks for being with us to discuss this tragic story. This guy clearly knew. I'm saying that, what do I know? But it seems like he would clearly know that he was suffering from a great problem with this depression. He was in the wrong business, don't you think?
Absolutely, and it's extremely scary, and it's more than devastation itself. We have to really now make sure that we have stricter tests more often, and possibly not employ all pilots that have been passing these tests in the prior cases. So, we're talking about depression, depressive episodes. The problem here in our society is that people feel this shame to depression, and depression is medical. It's nothing that you're responsible for. People are born genetically predispositioned to this kind of situation. We have to take that into consideration. And then again, there is depression where it's life events, and people do get this, where you're having a breakup in a love relationship, stress, careers, you name it. We get these things. But some people, some people do actually are more prone to it than others.
Yeah, Doctor, I just wanted to comment. A lot of people knew how bad the situation of depression with this man Lubitz was, but it was just getting the information to the right people. So I'm wondering if there will be changes in how doctors, that doctor-patient relationship, flight crews are supposed to report these kinds of illnesses, but it's voluntary right now.
Exactly, and this airlines, they tested pilots one time, and then that was it. So you're right. Why is it that it was not seen? He did tell people, but he didn't tell the right people for fear of not being able to continue his profession. Detecting these things are extremely difficult. People are often able to mask their inner feelings. But there's a word, and a psychological word. It's called pseudo-commando. And this fits into this category that we're talking about for this pilot, where people really feel a sense of anger and revenge, and they feel persecuted. They go ahead and they create these major acts of mass destruction, taking human lives with them. Mm-hmm. And he fits in under this revenge fantasy, where he had lack of self-esteem. He was quiet, he was nice, he was compliant, but he had self-esteem issues. And psychotic behavior is when you're broken with reality. And so he had his mission, and he was determined to follow that through.
Wow. Dr. Frieda Birnbaum, research psychologist, psychoanalyst, author, an expert on depression, women's issues, and much more. And we always appreciate having her on. Dr. Birnbaum, thank you so much.
My pleasure. Be well. Take care. Bye-bye.